Now, we're talking about the NHS this morning, and its almost complete failure to hit any of its targets in three key areas. They are waiting times for A&E, cancer treatment and planned operations.
A major analysis by the BBC found that none of those targets were met in England, Wales, Northern Ireland and Scotland A&E departments only hit their 4-hour treatment targets during the summer months.
Well, Peter Homa is one of the longest-serving chief executives in the NHS. He's currently in charge of Nottingham University Hospital's NHS Trust, and he joins us from there now. Morning to you. Thanks very much. I'm imagining it'll be a busy day in the hospital. Just tell us about these targets. You don't hit them. What do you make of that?
These targets are important as they provide a very important view for patients and their loved ones and indeed staff as to the timeliness of care, but they should be seen alongside other important objectives in terms of the outcome for patients and indeed the external assessment, including from the Care Quality Commission.
OK, tell us what you think it means for patients and, for example, their safety in the first instance.
In terms of safety, all hospitals, including Nottingham University hospitals, will have as their top priority patient safety. And we're very careful to make sure that, whilst on occasions the timeliness of care as far as emergency patients is less than we would want, and indeed that patients have a right to expect, that the safety of patients is safeguarded at all times.
Let's talk about particularly, for example, I know that you're missing the cancer target at the moment. And we've spoken to somebody on this programme who says, of course, every day when you've got cancer or a diagnosis and you don't know about your care, it just makes for sleepless nights, makes for worry, doesn't it?
Absolutely, we understand that very, very deeply. And indeed, I'm pleased to report that from Nottingham University Hospital's point of view, we're making very steady progress and we anticipate achieving that particular target on a sustainable basis from next month.
OK, but what about those patients who are being affected by it now?
Well, we are very, very sympathetic for those patients and we make sure that there's no adverse clinical consequence as a result of that, but I absolutely acknowledge the anxiety for the patients and their loved ones, and we're working very hard to eradicate that.
Now, you've been working in the NHS for many years. I imagine you've seen many changes. What do you make of what's going on at the moment? Would you say it's in crisis, that we're outgrowing it? What's your impression?
I most certainly would not say it's a crisis. I would say it's an extremely challenging position, amongst the toughest that I can recall. I'd also say in Nottingham, and I imagine elsewhere across England, we're better placed now than ever before through some fantastic work, not only within the hospitals, but across the local community services, primary care, social services, to make sure that patients, notwithstanding the winter period, get the service that they demand.
What do you think, and there is no easy fix, and we talk about this continually here on Breakfast, what do you think could make a difference?
I think it's a combination of activities. Firstly, making sure all of the agencies work as closely and effectively as possible together, making sure we have a resilient and sustainable recruitment programme, which includes making sure we're training the right professionals, doctors, nurses, allied health professionals and others. And of course, at the end of the day, it will come down to funding as well.
Right, let's talk about that recruitment. Are you having problems in your area in Nottingham recruiting the right people, or even recruiting people at all?
We are experiencing the same challenges that many hospitals are experiencing in terms of particular skills, doctors in emergency medicine, also nurses, but I'm pleased to say that we are making steady progress as far as that's concerned, and it helps enormously being a university teaching hospital where we're able to attract and I hope retain high quality staff. But it is a challenge, and it's one that I'm aware the government is responding to by increasing the number of doctors who are being trained, particularly but not exclusively, in accident and emergency medicine. Yeah,
and we know that people, behind you will be working incredibly hard today, looking after patients and all the rest of it. How are you preparing for the winter months? Are you concerned by this winter?
I think it's very important to acknowledge the superb work of staff in hospitals and across the wider health and social services sector. We have a detailed plan in place which we've already started to implement in terms of preparedness for winter, and that includes arrangements across all of the sectors in Nottinghamshire to make sure we're as well placed as ever before. And I would also comment that I've been a chief executive in the NHS for 27 years, including 37 years as a senior leader, and we have been, this year we're better placed than ever before to give patients and their loved ones the care they rightly deserve.
Peter Homa, Chief Executive of Nottingham University Hospitals, thanks very much for your time. I imagine you, like any hospital here in the UK, will have a busy day today. Thank you very much.